Trying again. Yep. So transition, healthcare, hospitals, that's what I'm here to talk about. So going from the kind of warm, fuzzy kind of children's healthcare services where there's, a video of the Lion King playing in the outpatient department to the adult outpatient department where there's a big poster on the wall that says, smoking kills, quit now. It's the big change. I can't fix a lot of the structural and systemic issues that plague our adult healthcare systems, but I can tell you how we can do a little bit better, help ourselves by, one, creating super teams, and two, being prepared. So creating your own super team means gathering together all the people that are helpful for your condition, your impairments, your education, your support, your NDIS providers, and having them work together. So, and then secondly, being prepared for going to hospital. It takes a small amount of effort to curate everything that you need or might need, but it's really well worthwhile. So before I do all that, I thought I better outline my credentials for talking about this. That I've got low vision myself, 1 degree of central vision, and it's not very useful central vision either, I have to say. And this all started before I was about 10 or 15 and has annoyingly continued to get worse since then. And I come from a family who have this same genetic condition, but also I have a family in which one parent and two parent-in-laws all have age-acquired sensory losses of hearing and vision. So, and I've been a doctor. I've been in the hospital at 2 o'clock in the morning when somebody comes in and says, "Oh, doctor, I'm on 2 little round white tablets in the morning, and then I take the one, it's really big. It's like a horse tablet, doctor." And sometimes I look at it and think, "Doris, I can't swallow that," and I don't. Okay, so I've been on that side where you don't know. Do you know how many little white tablets there are? There's a book. It's got 40 volumes and it's got photographs of all the little white tablets. And so, and then as well as that, all the stuff you heard before, I do the research, I do the writing, I do the, I listen to the lived experiences of people who've been to hospital. And, it's a pretty shocking experience for most. So how can we make things better? Super teams. Now, a super team provides care, support, and capacity building. It should be made up of all the people that we need to keep us well. It can be big, it can be small. It might only contain your eye doctor and your GP, and that's important. It might contain 8 people. There might be 10 at one time and 5 at another. There may be a bit of turnover, but you might find some people, like your eye doctor and your GP, might stay there for 2 decades. So it's really important. And this is also important for being organised with your NDIS reviews and applications, so that the super team is a group of people. Now, they can meet in person or by Zoom, or you can just be in control of your, each time you go, you have a list, you write down everything about all the important things. Don't dump on a doctor at the end of a long consultation and say, "Oh, by the way, I need a report from my NDIS and I need it like by Tuesday," because that's not very respectful. So be prepared, be organised. And having a super team helps us do that. And they also, super team members help educate each other. So, for instance, if you've learned a new skill, like something which we're going to teach a bit later on about social haptics communication, which is a system of touch messaging, then this is not widely known. So if someone from your disability support organisation has taught you some haptics, you can then have these taught to your super team members so that everyone knows what's going on. So this sharing of information is really important, and like cross-fertilisation, and it's and people are more likely to have really big, bright ideas if they're in a group with other people trying to have the other big, bright ideas. So a super team also has another function, can help support families and carers and partners. It can be really stressful living with people that have low vision and or other impairments. And, you know, my husband's constantly saying, oh, you're always losing things, Annmaree, and I have to find them for you. And I think about 30 minutes of every morning is spent finding my hearing aids, finding my glasses, finding my bag, finding some bit of paper that I can't even see, but I have to take and deliver somewhere. So we spend a lot of time. So it can be quite a frustrating experience, you know, making accommodations and understanding the difficulties and putting up with not just their own stress at what we're going through, but also, you know, having to live with when we're grumpy and unhappy because of whatever is going on with us. Okay, so a super team can help support families as well, and siblings and parents, and help them cope better. And they can also refer them to support groups, for example. So super teams can consist of, well, you know, anybody, GPs, registered nurses, community and allied health professionals, specialists, social workers, psychologists, hearing and vision rehabilitation, orientation and mobility expert, educators. I mean, I think we often forget the teachers, and educators really benefit from being included in super teams. So they can share what's happening on the ground, what particular difficulties in the classroom, and the information can go back the other way as well, because it's a really great way to learn what else is going on. Okay, so it's important to trust everyone in the super team. And this is where it becomes tricky. Don't sack your super team members until you've got someone else to replace them with, is my advice. It can take a little while. Ask around. How do you get good, trustworthy super team members? Ask around. Sometimes your educators may say, oh, Dr. Bloggs in Place X is really good. They look after, you know, a couple of the people here. Your friends also can be a source of advice. And sometimes you just have to make an appointment, go in and see how you feel. Now, Medicare funds items such as chronic disease management plans so that GPs can be funded. If it's a big super team, most of them are often anchored by a GP. If you find a good GP, people, keep them, nurture them, educate them, and keep them up to date with everything else that's going on, because they can really help with reviews, form writing, facilitating, and chairing meetings. Okay, so we've got our super team. Unfortunately, having a super team is not going to stop you from having a fall, an accident, getting another condition. Now, we wish it did. Having another condition and needing to go to a health or hospital service. So we still need to be prepared. So preparing people for hospital. It's really important that people with low vision, we help ourselves. but we need our families, our healthcare providers and all the other people in our super team. We often need people to help us curate things. Remember what I said before about not being able to find things? It's really important that we get a bit of help if we need it, to curate all the things that we need to go. And I'm going to say something really important here that everyone's going to be horrified if you're, younger than 20 something. You can't just rely on electronic copies. You can't rely on electronic record. You can't rely on electronic copies on your phone. You've got to have hard copies. And why do we need hard copies? Because sometimes the phone, and this is going to surprise some of you, runs out of battery. If you use apps that with AI, I've got news for you. As James Packer recently recommended, investing in energy suppliers, because with the coming of AI, vast amounts of energy are going to be consumed. So this is where if you use apps that use AI like Seeing AI or Otter AI, then you're going to consume the power much faster. So that's one thing. Second thing is having your phone, you've got to actually, got to be awake and alert to remember your number. And you've got to know where your phone is, so that it's not enough to just rely on your electronics device. So hard copies are really important. So, okay, we're going to have show and tell now. This is my going to hospital. Before we do that, so going to hospital, we're going to do show and tell of the things that I take. And unfortunately, I've been a patient too often, which means more than once. Okay, so where's my phone? Okay, I do take my phone, and on it I have a health folder with all my important information, my allergies, my immunisation history, my family history, the history of my impairments, my current medical stuff, my past surgical stuff, all in here, neatly summarised, and I try to keep it up to date. I also have in here photos of the medicines that I take, the labels, and I also have those listed in the current medications that I take as well. Because trust me, the time a doctor spends working out what the 2 little round white tablets are, if you don't have to do that, that is time spent communicating with you. So it's important to do those things. So the phone's got lots of important things in it. It has also got all your great apps. So your reading, it might have your reading app, it might have your voice to text, it might have your speech to text. So phone. Okay, so now onto the hard copy stuff. You need hard copies of all this stuff. And I think I've got a whole swathe of paper. Now, all these are kept in my bag. So I have a going to hospital bag. I believe it's I'm told it's a Fortnum & Mason turquoise O'Donnell bag. It had little raised things on it so I can feel it. Get any bag, it doesn't matter. Stick fluffy, if you want to distinguish it, find some fluffy stickers and stick them on so you can touch it and okay, that's my going to hospital bag. And in the going to hospital bag okay, what have we got in there? Information. We've got, because I've got deafness as well as the blindness, which is really irritating, as I mentioned before, I've got all the hard copies of all the stuff on my phone. I have also got the deaf-blind manual alphabet. Is that it there? Would that be it? Yeah. Okay. I've got a laminated card with the deaf-blind manual alphabet because I use that, and it takes on average people 20 minutes to learn how to use that. It's not hard, and it can be quite handy, stick above the bed for nurses to use. Even more important than that, I have, is that the haptics one? Yep. I have the health haptics chart. And health haptics are a touch messaging system that began in the Nordic countries in the early 2000s. And you've seen here, I don't know if you've noticed Susanna, she's been giving me haptic messages, yes, no, want to demonstrate, laughing, yes, no. so that I know that you people are responding to some of the things I'm saying. So we have a list here of the health haptics, and that includes yes and no, how to do yes and no using touch, how to signify taking, where's your arm? There we go. Taking a blood pressure by doing that. And that also means, you know, those observations, you get woken up at 2 o'clock in the morning because somebody wants to do observation. Well, if you have low vision and or if you've got hearing loss or anything, it can be quite frightening being woken up by a strange person in the middle of the night. And what they can do is they can do a plus sign, like a Red Cross cross, on your arm that says, I'm a healthcare professional, and put the cuff around your arm, like your finger about that, and I've come to do your observations. And you go, oh, great. Yeah, I don't have to worry about that now. So I have a chart with all that, and I have more than one because, and that's breaking news, hospitals are places of losing things, right? So not just body parts, not just dentures, but bits of paper. So it's always important to have more than one. And sometimes if I'm really organised, I even have a bit of blue tack. So I can blue tack it to the foot of my bed or the notice board behind my bed. It just depends what kind of bed you're in. So all that hard copy stuff is really important to have in your going to hospital kit. So we also have the health haptics we've done. We also have in there, we have other bits of paper. What have I also got? The contact phone numbers of people, health information, as I said before, the list of allergies, vaccinations, list of medications, all that, all in there. I also have a list of the apps that I use, and I have a list of the apps that are useful for doctors and nurses for communication, whether that's text to voice, or whether that's speech to text, or I tell you what, seeing AI is totally great. If you have a tiny bit of residual vision, it's really great for the hospital menus. Otherwise, you've got no idea what you're eating. And I know it's not worth eating mostly, but, you know, it's nice to be included in decision-making about your meals. We have all those things in, and also the things that relax you. So if you've got a Spotify, you know, playlist or whatever, you've got to have all that so that if you're not well, but one of the staff members can set that up for you and you'll feel better. And that's what this is all about, feeling better and getting out of there. We also have you know, glasses, batteries, all that sort of palaver. A small whiteboard. If you've got any residual vision, a notebook and a thick black pen, or a small whiteboard. We got a small whiteboard there. The small whiteboard, $2 from the $2 shop. And it's really handy because it comes with a pen. And if you can use a small whiteboard, it can be quite useful for people to write on in big letters or draw pictures and things like that. We also have orange silicone wristbands. Now, these were the projects I was involved with, and we sent probably about 10,000 out to several countries: Korea, UK, Canada, India, and Australia. And this was part of a small project which found that in a hospital, you go from place to place, and that information about your communication needs and your impairments may not go with you. So we have wristbands that say, and I've got no idea what this says. What does that say?
That one's I am deafblind.
I'm deafblind. And another one, we've got low vision ones as well. But since these are almost impossible to find, you can ask me and I can give you whatever I've got left. But the other way around is to hunt out blank ones, get an indelible black texture and write on it, whatever you want. You don't have to do, this is a choice you can make. A lot of people are very anti identifying themselves as having disability or impairments. But trust me, when you're in a hospital, that's a situation of vulnerability. It is always better to make sure everybody knows that you can't see or you can't hear or you need plain language or whatever it is that you need. And you can write that in your own words on a plain wristband. And it's just like this. We chose orange because, you know, all the other colours are taken. Or they're horribly gendered. So white is for the ordinary wristband, red is for the allergies, yellow is for biohazardous material, which I don't recommend anybody wearing. And things like blue and green are common hospital colours for other things, you know, for bedspreads and curtains and stuff. And pink is, you know, breast cancer, and it's, you know, and you didn't want to be too gendered. So orange seemed to be a really good one, and also because it's like, you know, different and stands out. So that's one way. It means you're not going to get someone's telling you, and this is in my research, nearly everybody complained about this. There's numbers of times the staff will say, when you say, oh, how do I get to the bathroom, x-ray, outpatients, whatever, follow the yellow line, dear. And you just go, well, I can't see the yellow line. Oh, look, there it is, right there. So it's really good to have some signifier, you know, in hospital. I can also tell you wristbands are really good if you're travelling and going through security. That way you don't have people making assumptions about your terrorist potential because you're not able to see very well. So we've got wristbands. I take the white cane into hospital too. Now, this is a multi-purpose item. It will help you get to the bathroom in the middle of the night. Hospitals are full of obstacles. So people leave their trolleys. There are trolleys left lying around, and it's really good to avoid those because none of us want to be in hospital and then get another reason for staying longer. But can I also demonstrate? Have you got the cane? Yeah. Cane is also useful. When you drop your clothes on the floor underneath your bed, you can use your cane to sweep under the bed and hook up the item of clothing. And I've done that. So it's a multi-purpose item. It's also a visible signifier. If you start tapping around the ward, it tells people, ooh, we've got someone with a vision loss in our ward. And handover nursing staff, I've been involved in research at UTS in which we looked at handover and how vital information isn't handed over. And so it's really important that you keep on telling every shift, every nurse, every person you come across, and it is exhausting and it will make you want to cry, but you've just got to tell everybody, vision impairment or low vision, whatever the phrase you want to use, explain what it is, explain what you need, and educate everybody. Anything else you need, special spoons, you know, special devices, brailers, anything you need. Some things you can't keep in the going to hospital kit. So you know, it's not sustainable to double up and have multiples of your iPads and recharging devices and batteries and whatnot. So I usually keep a list in there because just in case I'm not the one bringing, if I've had an accident in the street, which I haven't had yet, but it's always time. If somebody's bringing in the bag for me, I have a note in there that says, bring iPad, bring chargers, bring, so that all comes in and I'm as comfortable as I can possibly be under the dreadful circumstances. So that's each, finished? Yeah, each person's going to hospital kit will be different. Some people will have 3 things in it, some people will have 40. And it's just important that you just think, what am I going to need to get through safely and happily, and pop those things in. Thank you. Any questions?